Let me introduce myself. My name is Dr. Robert Lavensoff. I'm a graduate of the Illinois College of Optometry in 1955. Since then, I have been the optometric officer in the United States Army. I have also been the resident optometry at Kings Park Hospital. I have also served as professional guiding officer for the country of Liberia, working in the John F. Kennedy Hospital there, and opening up an eye clinic for the children of Liberia. I want to talk about the importance of eye examinations, especially for the older citizens in this country. I want to talk about how often an older person's vision should be screened. Not only the vision, but the health of their eye as well, because many of the diseases do not take its toll immediately, but come creeping on, such as glaucoma. And who should do the eye exam? Well, eye exams in the United States should be done by a specialist ophthalmologist who has a residency in ophthalmologist, a licensed optometrist who is required to do all of these tests at all times. And people should know what tests should be done and what they should expect from their eye doctor. And what they should expect from their eye examination is, number one, a glaucoma test. Number two, a diabetic retinopathy test. Now, diabetic retinopathy is an event that comes to people who have diabetes for a very, very long time, and some of those people will have what they call diabetic retinopathies, which is a disease affecting the blood vessels in the back of their eye. People with high blood pressure also will experience this. Now, this has nothing to do with glasses. This has only to do with the health of the eye, and if continued untreated, will go on to glaucoma. The last thing and most important thing of all for older people is a disease called macular degeneration. Macular degeneration is the disease of the optic nerve in the retina itself. It takes place in the most important central part of the retina called the macula. And that is the part of the retina that gives the most sensitive, accurate vision to the brain. Keep in mind, people do not see from their eyes. They see in their brain. So that the signals from the eye makes its way back to the back part of the brain called the occipital lobe, and there's where vision actually takes place. There's where vision actually interprets its own self. It straightens out the objects. It does everything that's required to see. Any place from the retina to the back of the eye is destroyed or damaged. Vision will be impaired. The last thing of all would be what they call the refraction. The refraction is that part of the eye examination which the doctor will measure the vision, the actual power of the eye, and there may be a difference between what the person should have and what the person does have. And when they do that, this can be corrected by eyeglasses. This has only to do with the size and the shape of a person's eye. The front of the eye is called cornea, the back of the eye is called retina, and in between is a object called the lens. All of these can be affected as we get older and older. So that macular degeneration will actually destroy vision. There's not a whole lot can be done for it, but there are some nutritional things that can be done, and latest therapy, there is some for macular degeneration, and that's the intravitreal. That means an injection directly into the eye of medicines, Avastin, that will actually control the macular degeneration. Macular degeneration is bleeding in the macular area of the eye, at the back part of the retina. And it will control that bleeding so that it can help people, a lot of people who were not able to be helped before. Of late, scientists have discovered that there are certain added foods, certain vitamins that will affect and help the growth or the course of the macular degeneration. These are called, let me think. These are called omega-3s, lutein, things like that. And you can go into any health food place, and you can find a lot of different companies that manufacture the materials. You should look for the one that says ARADS on it, ARADS eye formula. And that's a formula which has been tested by the Federal Drug Administration and seems to have the best effect. It will slow down and diminish the destructiveness of macular degeneration. It's very difficult to go through the actual process of macular degeneration, but it is a lengthy project. There are two types of macular degeneration. They're called wet and dry. The wet is where there is actual bleeding, blood flowing where it doesn't belong on the retina, and this blood will destroy the sensitive areas, the nerve areas of the macula. The other is called dry macular degeneration, and this is very, very much slower, but it's after a long period of time, it will destroy the vision. So that this one test is important for anybody over the age of 65 to go for. The next most popular one is cataract. Cataract is the sclerosis of the lens inside your eye that we're born with. When we're born, this lens is very, very fluid, and it gets thicker and thinner depending upon the distance of the object we're looking at. And as we get older, this object becomes harder and harder, more sclerosed. Also, the muscles that control the fibers that hold this lens in place become weaker, sclerosed, and harder. So that all of these things will cause the lens of the eye not to be active. When that lens becomes so compact, it discolors. And when it discolors, light cannot pass through it to get to the retina, and this is called cataract. Cataract is also a slow advancing process. And a frequent examination, at least once a year, to the eye doctor will reveal the presence of this cataract. And when the cataract becomes so thick, so dense, that it actually impairs the vision, that lens can be removed, and a substitute lens, a fake lens, can be installed where that lens was and provide the eye with vision again. The other thing that old people will suffer from is called presbyopia. And presbyopia is that lengthy process from when the lens begins to harden around age 40, 42, throughout the rest of your life, and that will destroy reading vision because there is no longer a device for focusing lens close to your face. So it's focusing vision close to your face. Once this lens is removed, the vision will be restored, but it does not have most of these lenses, these implant lenses, they're called implants. Most of these implants will not have the ability to focus light closer, will not have the ability to either move closer or further from the front of the eye, or fatter or thinner, so that you will require reading glasses to provide the power for close vision that the eye does not have. But the distance vision is corrected beautifully. Now remember, I said corrective. Nothing here is cured. People with diabetes will have a problem because the diabetes will affect the blood vessels that feed the inside of the eye. When they sclerose, they can actually break and bleed. It's called diabetic retinopathy or background diabetic retinopathy. When the bleeding occurs, little hemorrhages will appear on the retina itself, damaging the area of that retina to enable them not to see what they should see. This business of partial occlusion of the vessels of the retina will cause what they call little holes in the vision. As the vessels break more and more bleeding, these holes become bigger and bigger, and it can absolutely destroy vision. The treatment for this is mostly laser treatment, laser surgery, in which the ophthalmologist specialist can direct a laser into the area of the break, sealing it off much as a welder seals two pieces of metal. The last thing that we're going to talk about right now, or during this thing, is the actual course of vision in a person, in a human being. And that is, as we get older, our nerves in our eye, the retina, become less sensitive. The lens becomes inactive. The vitreous may get, which is the fluid that fills the back part of the interior of the eye, will become a little bit murky, not quite as fluid as it used to be. And thus, when this happens, they get what they call floaters, little floating that float around in front of your eye. There's generally nothing you do about them. You just leave them alone. The floaters are relatively harmless, unless they are accompanied by streaks of light, lightning flashes, that you see to the side of your eye. In this case, what's happening is the vitreous is retracting from the retina, pulling away from the retina, and causing the sensitivity of light flashes and large floaters. The floaters are caused by the retina itself being damaged and putting pieces of material, pieces of human material, floating into space, and you actually see those things float in front of your eyes. There's no treatment if it's a vitreous detachment, but if the retraction of the vitreous causes a tear or hole in the retina, this can be repaired with, again, laser surgery.